And welcome back. We've been discussing the role of different nutrients here in congestive heart failure. And I just wanted to give you a quick recap of the things that we've seen before we move on. We talked about coenzyme Q10, increasing ATP production, acting as a antioxidant. Hawthorn, increasing cyclic AMP, and also helping to reduce blood pressure as an ACE inhibitor. We looked at the effects of L-taurine, the most abundant sulfur-containing amino acid in the cells of the body, including the heart muscle, and all of the influences that it has. We're really just starting to understand the role of L-taurine, but there must be a reason why it's the most abundant sulfur-containing amino acid. So I think it does have some important applications. L-carnitine, transporting more fatty acids across the mitochondria, so that beta oxidation can occur, and improving ATP production that way, knowing that L-carnitine levels tend to decline when people start to struggle with heart conditions. And the role of D-ribose, helping to increase ATP via the pentose shunt pathway. So these things all have synergistic function. It's, patients who have early stage congestive heart failure or dilated cardiomyopathies, in my experience, are often not willing to take all of these things. So my go-to ones in the beginning, and the ones I've seen really work well, are CoQ10 and Hawthorn. I usually give them a CoQ10 Hawthorn combination out of the gate. Recommend it, make sure that their doctor will approve it. And then, if they're willing to add L-taurine, L-carnitine, D-ribose, I think it's in their best interest, provided there's no contraindication for that. So it really depends on the patient and their willingness to use some of these complementary things. But I think the evidence is there to support the use of these nutrients to prevent and to help better manage congestive heart failure in conjunction with standard medical treatment. And considering that congestive heart failure is increasing across the population and the leading cause of hospital admissions after the age of 65, I think it's very important that you be armed with this research and be comfortable being able to utilize these nutrients where they seem applicable. So I don't want to leave this topic without having a quick discussion about magnesium, because this often comes up, because it's tied into cardiovascular health in a big way. So magnesium intake has declined from about 500 milligrams a day on average in the 1990s to less than 175 milligrams per day, at least in the year 2013. And this is likely due to the more people using processed food. So our dietary intake from magnesium across the population has decreased quite substantially. The dietary reference intake, sort of what's recommended for adults, is depending on males and females, but it ranges from about 310 to 420 milligrams a day. Most people are getting about 175 milligrams. It's reported that about 60% of adults in the U.S. don't consume that recommended dietary allowance for magnesium on a daily basis. A lot of people are walking around with marginal magnesium deficiencies. And magnesium is the fourth abundant mineral in the body, the second most abundant intracellular divalent cation, and it's a cofactor for over 300 different metabolic reactions. It's required in terms of cardiovascular health. Magnesium plays an important role and has effects on the heart and vascular system. It's required for ATP production, both in glycolysis and oxidative phosphorylation, also stabilizing the cell membrane. It's important for nerve conduction, cardiac excitability, vasomotor tone, blood pressure regulation. Magnesium plays a key role, and a lot of its influences on the body just happen to impact heart and vascular tone. So magnesium helps maintain normal heart rhythm. This is the key thing about magnesium, where you can really point a finger and say it's important for the normal heart rhythm and to prevent arrhythmias. So doctors, sometimes when a person's having a myocardial infarction, will give the person an intravenous magnesium in the hospital to reduce their chance of atrial fibrillation and cardiac arrhythmias. But people with congestive heart failure are often at risk for developing cardiac arrhythmias. So for this reason, sometimes doctors may decide that magnesium should be part of the treatment for congestive heart failure. One well-designed study found that taking magnesium orotate for 1 year reduced symptoms and improved survival rates in people with congestive heart failure when compared with the placebo. So some early stage studies suggested some magnesium added to this cocktail might also be beneficial. Whereas results of studies using magnesium to treat heart attack survivors, so after the person's had a heart attack, using magnesium to prevent a second heart attack, one study said it helped, another study said it actually increased risk. So it's hard to know what to do once a person's had a heart attack and is stabilized. Do you keep giving them magnesium supplementation on an ongoing basis at a significant dosage? That jury is still out. With respect to hypertension, magnesium, we're going to talk about lowering blood pressure naturally in just a moment, but magnesium supplementation has been shown to lower blood pressure, but very, very modestly, just 2 to 3 millimeters of mercury for systolic, and maybe about the same maximum, up to 5 millimeters of mercury for systolic or diastolic pressure. It's not a dramatic change, but it's important. Magnesium, though, also helps to decrease platelet aggregation, and it seems to improve endothelial function. So I think that getting a health-promoting amount of magnesium each day is really sort of the target. So you look at the patient's magnesium intake, and I personally consider health-promoting doses of magnesium for just about everybody. Supplementing people usually somewhere between 300 and 600 milligrams a day. Roughly, you want a 2-to-1 ratio of calcium to magnesium if you're going to supplement. And the purpose of it primarily is to support bone density, for cardiovascular health, for energy production. But you have to remember that in patients that have a decline in renal function, you have to be very careful with supplements containing magnesium, because the urine route is the only way to excrete excess magnesium. So it's easy to develop hypermagnesemia, which can have very significant consequences, life-threatening, in fact, if too much magnesium builds up in the body. And these people also have to be very cognizant of how much dietary phosphate they're getting, and sodium and magnesium. Too much phosphate can precipitate with calcium, forming these calcium phosphate stones or crystals that can then start to lodge in different tissues and cause a significant amount of damage and cause further kidney damage. And of course, sodium retention can cause increased blood pressure. And with hyperkalemia, with too much potassium, you can get also heart rate irregularities leading to atrial fibrillation and these kinds of problems. So, in people that have renal failure, you have to be very careful with all of these minerals. So this takes us to the next topic, which is ways to reduce high blood pressure using nutrition and natural medicine. The first thing that I'll bring to your attention is that people who are overweight, the studies show that people who are overweight, who have high blood pressure, that 2/3 of them will see a return to normal blood pressure if they just lose some of the weight. Sometimes they only have to lose 10 to 15 pounds. And so just helping people who are overweight, who have high blood pressure, lose some of the weight. Forget about all the fancy supplements. Just losing some of that weight often will return their blood pressure to normal. And this is because it takes pressure off the thoracic vessels, but it also will then decrease insulin levels. When your insulin levels are higher, that tends to promote more sodium resorption in the kidneys, and with more sodium resorption in the bloodstream, it binds to water, it increases the blood volume, that creates more pressure in the system. So as a person loses weight, often their basal insulin and postprandial insulin drops, and so they tend not to resorb as much sodium through the kidneys, so the blood volume drops. It's easier on the heart to pump that blood. There's less peripheral resistance. And if the person's losing weight via doing aerobic exercise, then aerobic exercise has other benefits on lowering blood pressure. And we'll discuss the overall benefits of aerobic exercise in the course that's called Sports Nutrition Part 1. They'll really take a deep dive into endurance and cardiorespiratory exercise at that point. But also know that reducing alcohol intake also will reduce especially systolic blood pressure. As soon as you're having 2 drinks a day, as many people do, it increases the force of contraction of the heart. And just getting alcohol out of the diet or reducing it dramatically can often start to bring blood pressure down using natural interventions. And about 1/3 of people with high blood pressure are sodium sensitive hypertensives. So that means that 2/3 of people with high blood pressure, the amount of sodium in their diet isn't really aggravating their blood pressure problem. It only really applies to about 1/3 of people that have high blood pressure. But nevertheless, it's a good idea for people, because we ingest too much sodium in the first place across the population, to be reducing that sodium intake down to, just a couple of thousand milligrams a day, if possible. And, as sodium comes down, then we think there's less sodium holding water in the vascular system, so the blood volume reduces. So now there's less pressure in the system overall, and it's easier on the heart, and there's less peripheral resistance, and so both systolic and diastolic pressure then decline. And then one of the ways it's been shown to actually improve the urinary loss of sodium is through calcium supplementation. So we tend to live in a world where there's a high sodium intake and there's a lower calcium intake. Most people don't get the recommended dietary allowance for calcium each day from food. And so when you start to reverse that, as sodium comes down and you start increasing calcium in the diet, studies show that calcium helps to it competes with sodium for resorption through the kidney tubules. So you start resorbing more of the calcium and you start washing out more of the sodium, and you're urinating more sodium out when you actually ingest more calcium. And because you don't want to just take calcium by itself, you want sort of a 2-to-1 ratio of magnesium. With magnesium, then usually using a calcium-magnesium combination, roughly 2-to-1, is helpful. But studies show that giving some individuals, people especially who are sodium-sensitive hypertensive individuals, in giving them more calcium in their diet through food and or supplementation, getting them to 1,000 milligrams a day or up to 1,500 milligrams a day with a 2-to-1 ratio of magnesium, helps to lower blood pressure in a lot of cases. Remember that calcium and magnesium also help to dictate the cell membrane potential and nerve conduction, and they help to create a more relaxed vasomotor tone, so you can have some relaxation of the blood vessel, so you have less peripheral resistance as well. So these are other strategies that have been shown to help reduce high blood pressure. And then, of course, omega-3 fats from fish and fish oil and from flaxseed oil, increasing the production of prostaglandin series 3, which has a vasodilation effect on the blood vessel wall. So you reduce peripheral resistance, so now the heart doesn't have to work as hard, so the systolic pressure goes down as well as the diastolic pressure. We've also seen that garlic supplementation can lower blood pressure very modestly, but I'm concerned about it because the active constituents in garlic, the allicin content, can also cause GI erosion and lead to bleeding, and it also has a very powerful anticoagulant effect. There are reports in humans, several of them, some that I've seen firsthand, people using garlic supplementation ending up with serious gastrointestinal bleeds that actually can be life-threatening. So I tend not to use garlic supplementation. But CoQ10 and hawthorn, as we've seen, CoQ10 improves endothelial function, and by increasing nitric oxide release from the endothelial cells, you get more vasodilation, so there's less peripheral resistance, so the diastolic pressure goes down, and then the heart doesn't have to work as hard, so the systolic pressure goes down. And hawthorn has a similar effect, but hawthorn also acts as an ACE inhibitor, an angiotensin converting enzyme inhibitor, so you're not converting angiotensin 1 into angiotensin 2, and that helps to block these hypertensive effects. So I like using CoQ10 and hawthorn to bring blood pressure down. And as I said, aerobic exercise is a key factor, of course, for reducing blood pressure. I mean, generally, if you think about people who, there's chronic stress in most people's lives, and so with that, the sympathetic nervous system is turned on to a significant degree, and with more sympathetic nervous system output, the heart muscle's contracting a little harder, and there's more vasoconstriction at the peripheral level, raising both systolic and diastolic pressure a little. And then when you do aerobic exercise, there's a massive activity of adrenaline and sympathetic nervous system activity. Your blood pressure goes higher, of course, when you're doing aerobic exercise. But when the aerobic exercise is over, the adrenaline level goes down below the original baseline, and you're in a more relaxed state, and there's less sympathetic tone, and so the heart's not contracting as hard, and there's less peripheral resistance. And we think that's a key factor in helping to keep blood pressure down through aerobic exercise, this effect on the sympathetic nervous system. So we'll look at that in more detail when we get into the sports nutrition part 1 subject matter. And a couple of recent studies showed that ground flaxseed, 1 or 2 tablespoons a day, was able to help lower blood pressure quite modestly, but to a significant degree. And it's probably just the omega-3 fats that are in ground flaxseed, the alpha-linolenic acid slowly becoming converted to icosapentaenoic acid, and then from there you have its conversion into prostaglandin series 3, which causes vasodilation. And we think that's probably the effect. And then the 10th strategy, which I call autogenic training, is really meditation and yoga and progressive relaxation and deep breathing exercises. Anything that will sort of using mind-body will help to put you in a more parasympathetic state and tone down the sympathetic nervous system activity, so the heart rate slows down, the heartbeat is less forceful, dilate the blood vessels, more blood going to the viscera, less muscles going, less blood circulating to the muscular system. The fight or flight response is being reversed, if you will. So that's been shown to lower blood pressure as well. And I noted earlier that magnesium can also help bring blood pressure down a little bit. So combining that calcium with magnesium makes sense for a number of reasons. So those are the 10 things that I turn to when I see someone with high blood pressure, where I want to, even if they're on a medication for blood pressure, I want to use some lifestyle things to help them get their blood pressure down more naturally, so that their doctor could lower their prescription for antihypertensive drugs, or in some cases take them off their antihypertensive drugs altogether. So let's quickly just review those again. Person's overweight. 2/3 of people who are overweight with high blood pressure, if they lose some of the weight, their blood pressure returns to normal. That's a key one. Reducing alcohol intake, getting sodium intake down. For most people, that they need to do that anyway. Getting their calcium magnesium levels a little bit higher. Supplementation with omega-3 fats. I skip garlic supplementation. I often will give them CoQ10 and hawthorn, usually in a combination supplement that will get them to at least the minimum dosage range that you're seeing here. And of course, we saw along the way that L-taurine can lower blood pressure in some preliminary studies. L-carnitine can lower blood pressure in some preliminary studies. D-ribose has lowered blood pressure in some preliminary studies, but these are much more preliminary than the studies we have with CoQ10 and hawthorn. That's why I emphasize those more. Getting people to be more aerobically fit is always beneficial for cardiovascular health and can help to bring their blood pressure down. I like ground flaxseed as a preventative agent for a lot of reasons, for breast cancer, prostate cancer, more soluble fiber in the diet, more insoluble fiber in the diet for the colon, lowering cholesterol levels, and now helping to keep blood pressure down. And then getting people to find some method that's agreeable to them, whether it's yoga, meditation, progressive relaxation. They'll have to just pick the thing that they think that they would stick with. And even if it's just 5 minutes a day of a meditation to get started with, it can be extremely helpful according to the studies that we have. So remember, there's also these pharmacological agents. We will see these in Essentials of Pharmacology, and one of the other subjects on this platform. where I will review for you how these different antihypertensive drugs work: diuretics, beta blockers, calcium channel blockers, ACE inhibitors, angiotensin receptor blockers, and renin blockers, keeping in mind that all of these antihypertensive drugs come with some potential side effects. So that's why if someone doesn't have any comorbidity issues of importance, and they just have, high blood pressure, and they don't have renal failure or diabetes or some other comorbidity issue, that using lifestyle strategies is really what's recommended, and even in the textbooks of pharmacology, as the first line of defense. Now, in fairness, if somebody has diabetes, ACE inhibitors have been shown to actually slow decline in renal function in those cases. And as people get older, some of the angiotensin receptor blockers, the ARBs, some of those drugs have been shown in people with hypertension to decrease the risk of developing Alzheimer's disease as a secondary benefit. So these drugs have application. If people have arrhythmias or they have congestive heart failure, then some of these other drugs, become absolutely crucial to have as medicinal agents. So we'll look at all of that in Essentials of Pharmacology. So one last consideration is endothelial dysfunction. So in vascular disease, sometimes, people have heart attacks and their cholesterol's normal, as we talked about. In vascular diseases, endothelial dysfunction is a systemic pathological state of the endothelium, sort of that endothelial lining of the blood vessels, characterized by an imbalance between vasodilation and vasoconstricting substances produced by or acting on the endothelium. So what has to happen for the heart muscle, let's say, to get the blood that it needs is that the coronary vessels have to know how much to dilate or constrict to get the right amount of oxygen and nutrients to the heart muscle, depending upon the prevailing circumstances, what the demands are for energy. And sometimes you can have endothelial dysfunction where the release of nitric oxide or other agents are not satisfactory, and so that you don't get enough vasodilation, and so the heart muscle becomes starved for oxygen, and you have an angina or a heart attack, even though it's not really being caused by cholesterol itself. So endothelial dysfunction is a major factor in peripheral vascular disease and in vascular disease causing some renal failure, in risk of coronary events, and also transient ischemic attacks. So normal functions of endothelial cells include mediation of coagulation, platelet adhesion, immune function, and control of volume and electrolyte content of the intravascular and extravascular spaces. So those endothelial cells are helping to decide, how much blood flow should be happening, how much coagulation of platelets and platelet adhesion should be going on that's in the body's best interest. So when that's not working, we call that endothelial dysfunction. And it's a major physiopathological mechanism that leads towards coronary artery disease and other atherosclerotic diseases, so it can enhance the development of plaque in the artery wall. So a lot of things can actually disturb normal endothelial function. Diabetes does it. Smoking does it. High blood pressure disturbs it. Dyslipidemia, high triglycerides and or cholesterol levels. Obesity, just the aging process alone, often through oxidative stress, it disrupts the whole endothelial functioning system, so you get endothelial dysfunction, and the endothelial cells stop producing the amount of nitric oxide that's required to cause vasodilation. So you get all these secondary effects of adhesions of white blood cells and fat deposition into the blood vessel wall. You get smooth muscle and connective tissue proliferation, creating weeds in the lumen of the artery. You cause vasoconstriction, impairing normal blood flow to coronary, to the myocardium, and also in peripheral vascular disease to the fingers, to the toes, to the feet. And you get excessive platelet aggregation and thrombosis. So endothelial function is a critical factor here in cardiovascular health. So these are, as we saw in the previous slide, things that cause endothelial dysfunction, but these are some of the big ones that actually really impair the release of nitric oxide from those endothelial cells. So when you even if your cholesterol is not high, just eating a meal that has a lot of saturated fat after the meal will cause vasoconstriction and endothelial dysfunction. And constant high circulating LDL cholesterol also does the same thing. Cigarette smoking has a powerful effect on endothelial dysfunction, really making it worse. And high blood pressure as well as diabetes. And the more uncontrolled the diabetes is, usually the worse the endothelial dysfunction is going to be. Things that have reversed endothelial dysfunction, the way that you improve your endothelial function. We've already talked about this in a previous course, but folic acid, very important for molecules that are eventually going to help the body make nitric oxide. And antioxidants, by suppressing oxidative stress, tend to allow more nitric oxide to be produced, and you end up with better endothelial function. There's studies to show that. Endurance exercise has a tremendous effect on improving endothelial function, as does improved glucose tolerance, bringing your fasting glucose down, exercising and having better insulin sensitivity. It improves endothelial function. Weight loss then is going to factor into that as well, because your insulin levels will be lower, so you have better glucose tolerance. Supplementation with hawthorn has been shown to do this as well. And also an herb called Tribulus terrestris, which when it's 40% saponin content, helps to increase nitric oxide, and you get more vasodilation. That's one of the reasons why Tribulus terrestris is such a popular supplement to reverse basic types of erectile dysfunction. As men get older and they have more endothelial dysfunction, it's harder to get an erection, to get the nitric oxide to be released in the genitalia. But Tribulus terrestris in particular has a very profound effect on releasing nitric oxide in those blood vessels that feed the corpus cavernosum, to allow more blood to flow to the arteries, that then will allow that engorgement to occur, so you can get a better and more sustained erection. So Tribulus terrestris also has been shown to improve endothelial function, and it has been used in certain cardiovascular studies to show improvement of endothelial function and vascular perfusion in the coronary blood vessels as well. So I believe that takes us to the end of this section. So I hope you found this highly illuminating and useful, and I will see you back real soon.